Okay, let's go through individual adaptogen and let's start with Rhodiola rosea. Rhodiola rosea is one of my favorite adaptogens. I would categorize Rhodiola rosea as energizing and uplifting herb that brings joy to both him or herself or others in lives. Rhodiola comprises 73 different species, with the majority of them thriving in high altitude or cold regions. Many of them have been used for treating various conditions. For example, traditionally we use Rhodiola crenulata to treat mountain sickness in the Himalaya region. Rhodiola rosea is one of the most widely recognized species, known by various names such as rose root, rosen root, golden root, or arctic-root. It is native to the Arctic areas of Europe, and its root is primarily used for herbal purposes. Rhodiola rosea shares some common ingredients with other Rhodiola species, such as cylindroside, but also contains unique constituents specific to rosea, including rosalvin. In the USSR, Rhodiola rosea has been extensively used to treat asthenia syndrome. Asthenia syndrome indicates a composite of symptoms like generalized weakness, reduced working capacity, memory problems, headache, insomnia, or poor appetite, all of which Rhodiola can potentially help to alleviate. In animal studies, Rhodiola shares adaptogenic properties with other herbs, such as neuroprotective effect, immunomodulatory effect, as well as anti-stress properties such as the capacity to increase heat shock protein 70. Additionally, Rhodiola has its primarily active ingredient, cylindroside or tyrosol, with its structure similar to dopamine and catecholamine, so suggests that potentially applications in antidepressant therapy. It's important to note that these effects have only been demonstrated in animal studies, so we cannot directly extrapolate those results to humans. This graph also illustrates that Rhodiola can involve various pathways to achieve anti-inflammatory effects, including the common known pathway, the inhibition of NF-kappa B. Now, I would like to discuss 3 common health benefits of Rhodiola that have been studied in humans: depression, stress, and exercise performance. The first trial examining the use of Rhodiola in depression was published in 2007 in Nordic Journal of Psychiatry. It is a double-blind randomized control trial involving 89 patients with mild to moderate depression and were divided into 3 groups: a placebo group, a low-dose Rhodiola group, and a high-dose Rhodiola group, for a duration of 6 weeks. The result of the study showed that both low-dose and high-dose Rhodiola group had significant improvement in depression, insomnia, emotional instability, and somatization. There was no difference between the low-dose group and high-dose group. No serious side effects were reported. How about Rhodiola compared to antidepressant agents such as SSRI? This is a double-blind randomized control trial conducted at outpatient clinic at University of Pennsylvania, comparing Rhodiola to citrulline. The study included 57 patients with mild to moderate major depressive disorder, and they are randomly assigned to one of 3 groups: citrulline at 20 mg a day, Rhodiola at 340 mg a day, or placebo. It is to our surprise that the results show no significant difference in depression scores among the 3 groups. It is possible that the sample size was too small to detect a statistical difference. However, it's worth noting that the decline in the depression score was greater in the citrulline group compared to the Rhodiola group, and both of these groups show improvement compared to the placebo. Additionally, the Rhodiola group had a lower incidence of adverse effect compared to the citrulline group, including the symptoms such as nausea, sexual dysfunction, insomnia, or change in appetite. This figure from the study illustrates the change of depression score throughout the treatment course. Notably, there was a greater reduction in the depression score in the citrulline group compared to the Rhodiola group. However, it's worth mentioning that citrulline group also experienced more side effects. What are the adverse effects in Rhodiola? In this study, included 2 patients experiencing nervousness and 2 patients report dizziness. Lastly, let's talk about rhodiola as an adjunct therapy, in addition to antidepressants such as SSRI. This is a double-blind randomized controlled trial involving 100 patients with mild to moderate major depressive disorder and were randomly assigned to one of 3 groups: citrulline plus rhodiola at 300 mg a day, or citrulline plus rhodiola at 600 mg a day for 12 weeks. The results show that at 6 weeks and 12 weeks mark, there was a significant improvement in depression in the groups receiving a combination of citrulline and rhodiola, regardless whether it was a low dose or high dose. The high dose rhodiola group led to a more significant reduction in scores compared to the low dose. Notably, you can see here that rhodiola may help to reduce the side effect of citrulline. When used rhodiola and SSRI in combination, there was a reduction in SSRI-related side effects, such as sexual dysfunction. In summary, the use of rhodiola in depression, I would say there is not enough evidence to recommend the use of rhodiola as a first-line treatment for mild to moderate depression compared to SSRI. However, I do think that rhodiola may have some antidepressive effect, but it may be less effective than the SSRI agents. I do also think that there are potential benefits for rhodiola to reduce the side effect of SSRI medication and potentially enhance the treatment outcome when used in combination. Overall, we do need more medical evidence. Okay, what about stress-related fatigue? In a 2008 study, there are 60 individuals with age range from 20 to 55 who were experiencing fatigue triggered by the specific stressors. And in this study, it's important to know that the definition of fatigue is different from the chronic fatigue syndromes, where a lot of time identified stressors may not be present. In this study, 60 patients were randomized assigned to either placebo group or a group that taking rhodiola with a total of 576 mg a day over a course of 4 weeks. The result of the studies revealed improvement in the burnout scale, mental health, attention for both groups, so it suggests a possible placebo effect. However, the rhodiola group does demonstrate more significant improvement compared to placebo group. The study also found that only patients in the rhodiola group had a low cortisol level. This is another interesting randomized crossover study that involved 56 young physicians who are on night duty. One group started with a rhodiola of 170 mg a day, 14 days, followed by a 14-day washout period when they did not take any medication, and then they received a placebo for 14 days. The other group followed the opposite order. In this study, they used the total fatigue index to assess intensity of fatigue. They found that for Group A, who started rhodiola first, had an improvement of fatigue index during the first 2 weeks. However, for Group B, who started rhodiola later, showed no improvement in fatigue. I would deem this study as a negative study since it has inconsistent results between the 2 groups. Overall, I would say for treatment of fatigue using rhodiola caused by stress, I don't see enough evidence of it. There were other pilot or small studies that I did not present. However, overall, I feel that there is lack of evidence in the literature to suggest the benefits of rhodiola for stress-induced fatigue. How about exercise performance? This systematic review is published in Frontiers in Nutrition in 2022, assessed 10 randomized control trials on the use of rhodiola for improving exercise or sports performance. 5 studies in this meta-analysis examined the effect of short-term Rhodiola rosea on exercise performance, meaning that they only use rhodiola 30 to 6 minutes prior to exercise at a relative large dose, such as 1 grams to 1.5 grams a day. The remaining 5 studies assessed the effect of rhodiola as a long-term supplement. The 10 studies include various types of exercise, such as aerobic exercise, resistance exercise, or endurance activities. Most of the studies show a positive impact on the athletic ability and sport performance, including pain reduction, reduction in muscle damage, or improvement in explosive power. However, there was no observed reduction in the rating of perceived exertion. It's important to know in those 10 studies there is no obvious adverse reaction or noted. My critique for this systematic review is that most of the included studies are small, with a number of participants less than 50. The largest studies showed negative results, and exercise protocols were widely different. So overall, I don't think there is enough evidence to suggest the benefits of rhodiola use in improving exercise performance. In summary, I would say the Rhodiola rosea is an excellent adaptogen that have been used in traditional medical system worldwide. It has gained popularity since the time of USSR. It is uplifting, acts as an antidepressant, and provides stress relief. The onset of action is relatively fast compared to other adaptogens, but it still may take 4 to 8 weeks to exert full benefits. Based on the current literature, I don't think there is enough evidence to strongly support the use of rhodiola for depression, stress-related fatigue, and exercise performance, primarily due to the limited number of large-scale studies. However, despite those limitations, I still believe that rhodiola holds significant potential in those indications. I will consider recommending rhodiola to patients that are experiencing mild depression, fatigue, or low energy levels and in need of natural supplements to boost energy while improving mood. In general, rhodiola is well tolerated and has not been associated with any serious side effects. However, it is important to know that there is limited long-term safety study available, and the safety data during pregnancy or lactation is lacking. I will exercise caution when considering rhodiola supplementation in patients taking multiple antidepressants or taking MAOI inhibitors. While there is a theoretical possibility of rhodiola inhibiting the CYP enzymes, the clinical implications are currently unknown. It is interesting to know that there's one study suggests rhodiola may increase the concentration of losartan by up to 20%. That concludes the rhodiola supplements.